Scene is safe, wearing protective PPE, standard precaution, which is gloves and eyewear. The patient has given me consent to perform a neurological assessment on him. The patient is in upright, comfortable position. With the AVPU scale, my patient is alert. If we were doing a stroke assessment, we would use the mnemonic FAST, which stands for face, arms, speech and time of onset. We would also go through AEIOU tips, which is an indication of the patient's altered mental status. So A starts with alcohol and acidosis, E stands for epilepsy, I infection, O is overdose or underdose, U is uremia, T is trauma, I is insulin, P is psychosis and C is stroke. Now I would perform a blood glucose level check on my patient. The normal range for a person is between 4 and 5 millimole. Anything below 4 is hypoglycemia and everything above 8 is hyperglycemia. So I've got my Sharps kit where my lancet will go in, strips and glucometer. I would gain consent from the patient and talk them through what I was going to do. So now I'm going to prick your finger with the lancet and draw blood and get a blood sugar reading. .8, so that's a normal reading. Now I would go through the Glasgow Coma scale. So my patient's eyes are open, so he would be getting a score of 4, which is spontaneous. A score of 3 is voice, a score of 2 is pain, and a score of 1 is nil. My patient has been verbal, so he would get a score of 5, which is orientated to time and place. 4 is confused, 3 inappropriate words, 2 incomprehensible sounds, and 1 is nil. Motor response is 6 because my patient has been obeying commands. My patient would now have a score of 15. 5 localises to pain, 4 withdraws from pain, 3 is flexion, 2 extension, and 1 is none. Now I'm going to perform a pupil response just to see if the patient's eyes are equal and reactive to light and check the patient's pupil size. If you could just look at my shoulder. Both of the patient's pupils are equal and reactive to light and they are about a size 3.